always checking in with you,
Mm-hmm.
and you're not doing it alone.
Yeah. Yeah. Even when you don't notice it yourself, sometimes I'll click on the screen and I'm like, oh, today's a day, huh?
Mhm.
And nothing is even said.
Yeah. Yeah.
Um, so yeah, just following your process.
Mhm.
Being able to follow people's process as a trauma therapist is so powerful.
Who would you say is best suited for EFT?
Yes, for EFT, I would say you apparently you can use EFT for a lot of different things, right? In that field. So a lot of people use it for like cravings or addiction issues, money management issues, things like that. In my practice, I use it specifically for people who have trauma. Um, and I do believe that people have to be resourced, at least in my practice, resourced enough to like process the trauma, not be in it, or have other things going on. I think we talked about it in a previous episode, like job insecurity or
Right.
houselessness, things like that. We got to solve those problems first. I,
Mhm.
I can't tap you out of systemic issues. Uh,
Exactly.
that's
I
not,
can't tap you out of that.
I
You
can't
are
tap.
supposed to feel the full brunt of that.
You're supposed to feel that and you get to feel that and we can figure out how to like move you through this process, right? So people who have resources internally and externally would be like the best suited for it and it's most effective with that population.
Mhm.
What about you?
So EMDR has been used for a number of emotional overwhelms. It is classically used for PTSD, so folks who have experienced at least one single traumatic event, but it
Hmm.
can be really helpful for folks who have had multiple ongoing, long-term developmental
Hmm.
traumatic events. Um, so we see this for folks who, veterans, people who live in community violence, maybe a car accident, or they're first responders who are exposed to, secondary trauma of working with other people. But it can be helpful in folks who are living with anxiety and panic, eating disorders, even pain management. It has been a really useful tool in helping folks get some emotional relief. That's the ultimate goal, that you get relief from the thing that is overwhelming you.
Yes, yes. I love that you said pain because I forgot to say that. That is one of the biggest targets for EFT is like pain management. And typically from what I've seen, when it's emotional pain, we talk about pain being in the body a lot, especially when it's connected to a trauma.
Right.
What I've noticed is that the either the pain or we call it sensation because sometimes it's not a pain, right? Sometimes
Physical pain.
it's a like, oh, I feel a knot in my stomach. It's not painful, but I know it's there and it's pressure
Mhm.
or
Mhm.
something like that. What I've noticed in my clients is when I do that kind of work around sensations that have been there for a while, it typically goes away if it's connected to an emotional trauma. Right now, I can't speak to physical traumas like car accidents or things like that where there was something physically that happened to your body.
Yeah.
But with the emotional things, I've noticed like a significant decrease in that pain.
Yeah. And that's the ultimate goal, is that there's people who have some real, neurological or, physical reasons why they have pain. And while it may not be zero, pain is both a physical and an emotional experience.
Mm-hmm.
We know that when folks have a broke ankle, when they walk on it, it's going to cause them to be really sad and disappointed that their leg is not working properly, right? But it also goes the other way. If you're depressed and you're unsupported and you're having a hard time feeling good about yourself, it's going to make your physical pain greater. And I think that's how
Mm-hmm.
therapists can be really helpful with these type of modalities in pain management, in lessening the severity of how it's, kind of taken over someone. Do you have any research about EFT uses and effectiveness that you can share
I
with folks?
Sure, yes, I do. Let me pull that up real quick. So there's a lot of research. Well, again, my research is specific to stress, anxiety, trauma, because that's kind of like the work that I do. But I was looking it up and it says that 37% of cortisol levels drop after tapping. 40% of anxiety is decreased, 35% of depressive symptoms is decreased, and 74% of food cravings. And we know that's a big one when it connects to like stress and trauma.
Mm.
Um, and then there's a 31% boost in just overall happiness and peace.
Mm.
There was a study with 100 veterans. I'm gonna just try to gloss over this real quick, where 90% of the veterans had reduction in symptoms to where they no longer needed clinical treatment. And that was sustainable. They tracked
Wow.
them over time and they were good to go after 6 sessions. Um, so pretty powerful stuff.
Yeah.
Uh, yeah, what about you?
Yeah, I just want to kind of pause what you said and really highlight when we talk about trauma and living with the effects of trauma, what you shared offers the fact that you can get relief and recovery from it,
Mm-hmm.
right? It's
Mm-hmm.
not just like I go to therapy every week and that's what's keeping me alive or keeping me sane or keeping me manageable, but that because of the treatment you participate in, it allows you to live a life free of overwhelming disturbances, overwhelming distress.
Yes, yes. And you get to graduate therapy. I think people don't realize like when you are doing effective therapy, you could choose to stay in it as like a maintenance, right? Like
Right,
that is a
right.
choice, but the relief will be there where you don't feel like you have to go,
Mm-hmm.
right? Because you're doing really effective work with your therapist.
Yeah, that you're able to take care of, stuff when it comes up in real life and you're having
Mm-hmm.
a traumatic reaction, but you managed it, right? That's
Mm-hmm.
the ultimate goal. So, EMDR has been around since the late 80s, so over 30 years. There's been a lot of research on it, primarily looking at veterans and folks who've experienced traumatic events. With the EMDR Institute, it's an international institute, and some of the research that has come out of it that looked at when a person has worked with a qualified therapist, oftentimes a certified therapist, for 6 to 12 sessions, that they saw the following benefits. With former and current combatants who went to war, they showed a 78% of reduction in PTSD symptoms after 12 EMDR sessions.
Mm-hmm.
Kaiser did sponsored a research that looked at folks who had a single traumatic, experience like a car accident or, being robbed or something like that, that
Mm-hmm.
100% of those people and 77% of people who've been impacted by multiple traumas showed no diagnosable PTSD symptoms after 6 EMDR sessions.
That's so good. So 100% cleared after 6 sessions.
For 100% cleared after one, if they've had
One trauma.
one trauma. But
Mm-hmm.
folks who've had multiple traumas after 6 sessions, 77% of those had no diagnosable PTSD symptoms.
That's big.
It's
That's big.
huge to
Yeah.
be able to say that we can provide some relief with some very focused treatment.
Yeah.
Um,
So
it,
what I'm hearing is people are able to sleep at night. People are having balanced diets. People are not feeling anxious going to work. They're having
that they can work.
they can work, right? Healthy relationships, being brave enough and courageous enough to try to, build healthy relationships and not being guarded. Like all of this can come out of, doing some really powerful trauma work and finding relief.
Yeah, it's
Mm-hmm.
possible.
It is possible.
It looks different. It looks and feels, I have to be honest, it looks and feels different. Some people don't like the experience of it. So, with that being said, are there any counter indications? Is there any risk for folks participating in EFT?
I would say for EFT specifically, one of the biggest risks is because it's not, you can find a practitioner who is trained and certified in EFT, and they are not a therapist, you
Oh,
know.
okay.
So that might be a risk when you're working, because with EMDR, you guys are all trauma trained. Like that is a trauma modality, right?
Right.
For EFT, it is more of a specialty under the EFT umbrella of like, okay, now I'm going to be trained as an EFT trauma practitioner.
Mm-hmm.
So those are some of the risks that could go with it. Let's see.
That there might be someone who they may be limited in what they can.
They might be limited, and also, you know, it is important to do your research around the provider because it can be re-traumatizing, right? If they don't know about the window of tolerance or like resourcing or these things that you have to do when you take the trauma training for EFT.
Okay.
Those things are not included in just like a basic EFT training,
Got it.
you know. So being mindful of that. What about you?
So EMDR, there are some people who are not eligible, like they wouldn't be good candidates because it could cause more issues. So folks who are actively suicidal, they have an intent and they've acted on it. Folks who have an acute psychosis, those they may not be good candidates for PTSD treatment. So it's best if there's no urgent need of treatment, meaning you probably require hospitalization, psychiatric evaluation or hospitalization. Sometimes when folks are actively using substances, they may be excluded
Mm-hmm.
from, as I think would be true for most therapy that is
Mm-hmm.
not focused on substance abuse management treatment. Uh,
Yeah.
so those are some of the exclusions for folks who where intensives is one option. So sometimes people need longer sessions or they benefit from having a session where there's extended hours where they work on their issues. Some of the exclusions could be childhood abuse, not
Mm-hmm.
having enough coping resources, because folks can get really dysregulated because we're
Yep.
bringing all whatever you push down for many years, we're bringing it up to the surface. So we have to make sure that you're able to tolerate it. That's why we don't just jump to trauma. There's a bunch of preparation. And sometimes we may decide you're not a good candidate at this time. So it's
Mm-hmm.
not that you're excluded forever, but it just lets us know we need more preparation. So people who have high dissociation on an extreme, that can look like multiple personalities, people who are unable to really stay present,
Mm-hmm.
um, have a harder time reaping the benefits of this treatment.
Mm-hmm.
There are folks who do have high dissociation, so we have to work on helping them stay present in order for them to be able to participate in it. But some of the risk would be, suicidal, psychosis, substance use. Also, if you're like in a legal case, if you have, if you're working with a lawyer and you're trying to say this issue caused emotional distress, you may not want to participate in EMDR because you will no longer meet criteria. You will get better.
Yeah. Yeah. And out. Yep. I hear you. I hear you. Well, I mean, you just broke it all down. So that's the same for tapping.
Okay.
All of the things, right? Like dissociation, um, resources, all of those for sure.
Mhm.
100%. Yeah.
So if you're interested in learning more or wanting some resources from either us on EFT or EMDR, we're happy to share that. If you reach out to us, there's a lot of information, obviously, on if you do your own Google search, but we're happy to share what we have. Um,
Mm-hmm.
Sometimes that's specific articles that we think are relevant, or it can be books that you can look at, or journals, or online resources that we've kind of cataloged to make it easier. But we do implore you to research what could be a good fit for you. There's a lot of different ways to treat trauma, and we have two that we
Yeah. Yes, for sure, for sure. And, you know, if you have any questions, feel free to drop them in the chat. Let us know what you want to see more of. And we'll see you next time.
Take care.
Bye.